We're so fortunate today to have somebody from Direct Relief to talk to us about the hurricane aftermath and what people are doing to help others who have been seriously impacted by this, what you can do as well, and really the full effect of this on these communities. Yvonne, thank you so much for joining us.
Thank you for having me. It's a
Can
pleasure
you,
to be here.
I know that you've seen this before through your organization. Can you talk to us about how hurricanes as serious as this do affect people in these communities?
Yes, definitely. I'm from Puerto Rico, so I know we still have PTSD from Hurricane Maria back in 2017. Back then, the entire island lost power. We were without power for, in some places, up to a year. So the lack of communication, power, access to healthcare services, it's really tough to come back from a situation like that. Direct Relief has been monitoring and studying these hurricanes and natural disasters in general for many years. And that's at our core, right? And we knew this season was going to be rough. Every year they get stronger, more frequent. And but it's July. It's surprising that it started this strong, this fast. So it's definitely scary. Now, as you know, Beryl broke record for the strongest hurricane in July. It used to be Hurricane Dennis it hit Cuba back in 2005. So it's definitely concerning. We know we definitely we need to start preparing, and we need to start working on the resiliency of these island nations in the Caribbean, because we know it's going to continue happening.
Can you give us a little insight in what folks can do?
Definitely. At an individual level, we always say it's very important to know your routes, know where the shelters are, where the hospitals are, where the clinics are. As a health organization, we always remind individuals that it's very important to have their refills on any medications they are taking up to date. If they have prescriptions, they should have it at a backpack near the entry door, because if they need to evacuate quickly, they cannot forget to take those. It's very important, right? As we have learned, not many people die from the direct impact of the hurricanes or these type of storms. It's what happens afterwards, right? It's the access to services, to medical services in specific, right? Back in Puerto Rico and in many places with Dorian in Bahamas or in US, Texas, Florida, we lose power, right? And since we are in islands, it's much difficult for materials to get shipped in, to start communications again, or to reestablish a connection. And there's a very important correlation between power and health, right? Without power, there's no access to healthcare services. So it is very important, again, to be prepared and to take those prescriptions with you.
Can you talk to us about the organization Direct Relief and the mission?
Yes, our mission is to improve the healthcare and the access to to health services of the people that are impacted by natural emergencies and poverty, right? Right now, for Hurricane Beryl in the Caribbean, we have been one of our most important programs is the Hurricane Preparedness Packs, where before the hurricane season starts, we pre-position stockpiles of medications. It includes medical supplies, wound care supplies as well, and we pre-position them in specific areas where we know it's very possible that the hurricanes are going to be passing across. So we did have two of them in St. Lucia, and with the assistance of OECS, which is an organization, another nonprofit organization that we have partnership agreements with, we were able to move them from St. Lucia to St. Vincent to start in support. We have been continuous communications with the Ministry of Health of St. Vincent, and we are now providing hygiene kits. A shipment left Santa Barbara today with hygiene kits, and there's another shipment from Puerto Rico to St. Vincent with medical cots and a tent for shelter.
Having been through a very serious hurricane yourself, do you have any words to share with those who are being most impacted right now?
My heart is with them. I know it's tough. We definitely have to take this seriously. We need to prepare. Last year, for example, Direct Relief congregated an event where we invited ministries of health of 15 island nations. And it was very important because we started learning from each other and talk about learnings and what can we better, talk about resiliency. And we have to continue that conversation because, again, these emergencies are going to continue happening. So they know that everybody that is suffering right now from the impact of the hurricane know that Direct Relief is here, and we're going to continue supporting everybody in the neighboring islands.